The World Health Organization projecting a global shortage of 4 million nurses by 2030. Analysts say India could help fill the gap as it trains more nurses than any other country in the world.
But as a significant portion seeks jobs abroad, experts want the government to expand funding to retain talent and boost the country's stretched healthcare system. Ishan Garg reports for CNA from Kerala in the second part of our series on the global migration of nurses.
Providing care is a calling, not just a profession. It's something final year nursing student Caroline Thomas says she learned from her mother, also a nurse. But as she prepares to graduate this year, home is not where the heart is.
My dream is to work in USA.
It's not a lack of jobs in Kerala where she lives, but pay that she says is too low for a comfortable life.
For my profession, that kind of pay is only providing in the abroad countries. So I think it's better to have some experience here. I think 2 or 3 years, then I should move to abroad.
Nurses in private Indian hospitals earn about $200 to $600 a month, compared to 3 to 5 times more in the Gulf and up to 10 times more in North America and Europe. Government jobs here pay significantly more, but nurses complain vacancies are few and far between. Low pay and grueling working conditions put India in an awkward position. It trains nearly 400,000 nurses a year, more than any other country, yet many move abroad. About 640,000 Indian nurses are estimated to be working in foreign countries, second only to the Philippines in nurse migration. Some 500,000 nurses from Kerala already work abroad, and the state has long led India in nurse emigration. The migration of nurses from Kerala took off after World War II, when Christian missionary networks helped recruit healthcare professionals from here to countries like UK and Germany. In the decades that followed, the Middle East became a major destination. Now, as European countries are facing a severe shortage of healthcare professionals, programs to train nurses here and send them to those countries are once again gaining momentum. In December 2021, Kerala signed a deal with the German government to supply nurses for the country's struggling healthcare system. But critics accuse Kerala officials of institutionalizing brain drain at a time when India's nurse-to-patient ratio is 2.23 per 1,000 population, below the WHO benchmark of 3 per 1,000. Officials argue the issue is more complex and that there's actually an oversupply of nurses in South Indian states.
There are no dearth of nurses because 25,000 every year we are getting 20 to 25,000 nurses are coming out of this institution. So currently in my state they are facing underemployment because nurses are working at inferior at a very low salaries.
But across the country, the picture is starkly different. Reports say 9 out of 10 people living in rural India must travel more than 10 kilometers to access health care. The Indian government says it's invested billions of dollars to add 82% more medical colleges between 2014 and 2023 and added 157 new nursing colleges in the same period. But experts say the country should spend close to 5 to 10% of its GDP on healthcare, up from about 2% presently, to improve healthcare staff pay that could potentially reverse the migration of healthcare workers.
We must think about the issue for the next maybe the 50 years. So we need more money there. That's the bottom line. We need more money there. That precise training for particular subject is we have a deficit there. For example, if you take ICU, intensive care unit, maybe a cardiothoracic unit, or maybe a coronary care unit.
There are some who wish to stay back, adding a much-needed boost to India's healthcare system. Whether at home or abroad, Indian nurses continue to answer their calling, serving on the front lines of a profession on which millions depend for survival and care. For CNA, I'm Ishan Garg in Thiruvananthapuram, Kerala.
And you can find out more about the exodus of trained nurses from lower income to wealthier countries and the devastating impact on local healthcare systems. CNA correspondent examines the outward migration of nursing professionals and the consequences for home and host countries.
Nurses Beyond Borders airs tomorrow at 9:30 p.m. Singapore, Hong Kong time on CNA. And you can also find our series on our digital platforms. Head to cna.asia or download the CNA mobile app.